All right, let me start my video here. Thanks, Bridget, and thanks very much for the welcome from the Northern California HIMSS chapter, and Bridget for your help in putting this session together. So, Bo and I are here to talk about cybersecurity, emerging trends beyond regulatory requirements. My name is Chris Ross. I'm the Chief Information Officer at Mayo Clinic. And my colleague Bo Woods is a senior advisor and strategist for cybersecurity and with the Cybersecurity and Infrastructure Security Agency, which is part of the Department of Homeland Security. A few housekeeping items. We're doing questions through the Q&A session, not through chat. You can see that at the bottom of the bar. You've probably heard that drill through the day today, would be my guess. Please put your questions there. And if you want to indicate whether it's a question for me or for Bo, and I think most of your questions are going to be for Bo, that would be just fine. And you can vote them up and vote them down. At the end of our discussion, we'll get to all those. So I was asked to come here and give a little bit of a perspective on cybersecurity. I'm not a CISO. My CISO is fantastic. But what I kind of wanted to do was to give a perspective from a CIO perspective, which is slightly different than what a CISO might have on top of mind. And then Bo's going to talk a lot about what the landscape looks like and what it is that CISA can do to support all of us as we deal with these issues. So let me see if I can get my slide to page down. There we go. I want to talk a little bit about the threat landscape as we see it. This is a view that I think a lot of hospitals have, and I think these are, somewhat in order. Our number one concern at this time anyway is criminal ransomware. As you know, there's just an enormous amount of activity happening. Wanted to highlight things like the Conti ransomware, which is in a lot of attacks, but it's Colonial Pipeline, it's a lot of healthcare institutions. It's aimed at all of us, and it ranges everywhere from commodity on the market ransomware to very sophisticated criminal gangs who are developing specialized ransomware. And as you all remember, ransomware originally started as locking up someone's PC to get a few dollars, and now it's the point where it's not just a freeze your PCs, as if that wasn't a big enough problem. It's also ransomware that's intended to exfiltrate data as a way to hold the data ransom at a different location, which is a problem in particular for those of us in healthcare because we've now lost control of the data, breach violation that needs to be reported, and so on. So ransomware is really number one on our radar. The second one would vary, I think, by institution for institution, but a lot of us are worried about nation-state espionage. And that probably applies most significantly to those of us who run research organizations, academic medical centers. I would say at Mayo Clinic, probably like a lot of other institutions who are represented in the webinar here, we treat some patients who are high profile political characters and others who would be of interest to nation states wanting to know more espionage about those individuals. So it's a combination of IP theft and also to gain some leverage based on potentially following people around as they receive healthcare at our institutions. I think third on our threat landscape at this point would be attacks via trusted third parties. So you think about SolarWinds, for example, which was broadly used, certainly thought to be an ally and a colleague, turned out to be an attack vector, which was a shocking and in some ways very innovative means of attack. But I think a lot of us have medical devices which are supported by third-party vendors or by the vendor of the equipment themselves, who have rights to dial into our environments to do maintenance and upgrades. And that's clearly a risk in our environment and a difficult one to mitigate just because of the way that healthcare technology is operated. A fourth risk would be business email compromise. And, phishing has gotten to be incredibly sophisticated with targeted spear phishing kinds of attacks, but also impersonation of things like law enforcement, government officials, or a corporate officer, an email that comes to you from your CEO that's not really from your CEO. So much of malware is distributed via email that then takes you to a link that then has a payload that's negative, that it has to stay on our radar. Another is attack on vulnerable assets. The Log4j attack is certainly not going to be the last of its kind, of where a commonly used piece of shareware was exploited in a way that it became an attack vector into many of our environments. Now, vulnerable assets here could also include things like the Internet of Things and biomedical equipment that I mentioned earlier, which is vulnerable. Everyone knows the drill. Biomedical devices, for the most part, the mechanical life is often longer than the digital life, meaning that we have perfectly serviceable mechanical equipment like radiology devices that have old software on them. And the challenge has been to try and keep those software upgrades up to date. And there's some complexity with FDA regulations and other things that makes that hard. And the last threat that we're worried about is really more of a technique than a threat in some ways, but it's this idea of max exfiltration of data, which we're seeing more and more of these kinds of attacks, where the goal has been to get a tremendous amount of data and to move it at scale outside an organization. And that's a new kind of attack, in some ways connected to ransomware. So what's a CIO to do? This is incredibly oversimplified and something that would need merit a lot more attention. But I'd give you a viewpoint, at least from my chair, of what am I worried about. The first thing that I'm worried about is, what does my attack surface look like, and where are my vulnerabilities? So I'm thinking about things like legacy assets, like data centers and legacy applications that are written in old code, haven't necessarily been maintained. I don't like anything in my own data center. Our infrastructure team does a fantastic job, but I can invest a certain amount of money on security. A cloud vendor or a software as a service vendor can invest multiples or 10x or 100x what I can spend on security. So these legacy assets are really going to be a challenge. Medical devices, certainly next on the list, along with other IoT like HVAC systems and other things that can be exploited, payment terminals, those kinds of things. The attack surface is also defined by wide open business environments. At least in our environment, patients come and go freely. We have external researchers who join us and work on research projects, and despite our best efforts to try to do non-employee access verification and so on, it's still going to be a risk for us. No other business of the scale at which we operate allows people to come and go from our headquarters to the degree to which that happens every day at our hospital and clinic institutions. And then, of course, there's insider threats. In our instance, that could be a researcher, for instance, who might be planted for purposes of doing nation-state espionage rather than doing research. But there's other kinds of insider threats like disgruntled employees, other kinds of things. I would say in our increasingly work from home environment, this is going to be a bigger issue. It's harder to have that kind of social network that allows people to kind of keep track of what their colleague is doing and know whether someone might be an insider threat. Then finally, the innovation that we are all pursuing provides an attack surface. And that would be things like digital front doors, in which we open up yet one more vector in which we are connected to the outside world. We're all trying to put together data that can be used for treatment purposes and innovation purposes, and that creates a vulnerability in its own. And then there's things like robotic process automation and low code, no code, which isn't necessarily built to the industrial class that we would want, including industrial characterizations around security. So I hope that those 6 items have scared you to death like they scare me to death. I'm worried about them every day. So what do we do to reduce that attack surface? A couple things. One is at least our institution is aggressively pursuing software as a service as one of our first strategies, not just for security, for other reasons as well. But look, if I've got software running in 6, 8, 10 different vendor data centers, yes, they might be hosted on Amazon, Google, or Microsoft, but they're partitioned by themselves. I've diversified my risk from a security standpoint, right? If my Epic friends are hacked, God forbid, the rest of the inventory continues to run and isn't affected by that by a ransomware attack, for instance. So software as a service is a way for us to diversify risk. The second is, what can we do with cloud? And I've already alluded to this. I know that a cloud environment is going to be more secure than what I can engineer. And I say that with apologies to our infrastructure team, which is first rate. But literally, the platform as a service and infrastructure as a service vendors are spending orders of magnitude more than we can on security. Segmentation, particularly network segmentation, for us is an important way to try and reduce attack surface. By dividing our institution into pieces, it makes it much harder to have lateral action within our environment for an attacker. And then finally, things like least privilege, privileged access management, better vetting of non-employees so we understand credentials and so on are really important. And the last thing is, from a CIO perspective, my CISO's got lots of great ideas, and so does the rest of their team. And they've put in place this really great discipline, which is find your framework and really make that your North Star. And so for us, that has been NIST, and we're trying to build everything around the NIST set of cybersecurity standards. Is it perfect? Probably not. Is it more than adequate? Absolutely. And then we're aiming at things like SOC 2 Type 2 certification, high trust certification, of knowing whether we did a good job of implementing those NIST frameworks. So, everybody loves a top 10 list. Here's mine. From a pragmatic perspective, these are the kinds of things we're looking at. Number one, asset management. Know what your assets are, both physical assets, applications, and databases. Manage them in a CMDB. Know what their characteristics are. It helps both from the standpoint of making sure that they're mature and well secured, but it's also the repository that you're going to depend on in order to do response should you have malware in your environment. Identity and access management as a way of being really robust in understanding what security rights exist and not. We, like many other people, are trying to aim towards a SASE and zero trust environment where we push security out to the edge. That means that we need to have an absolutely first-rate platinum identity and access management environment. Enterprise data security, both structured data, know what's in your databases and be able to protect them, but also unstructured databases. What's all that data that's being kept in SharePoints and so on? How does that move around the world? Do you know what's in Box coming in and out of your environment? Do you know what's in Amazon coming in and out of your environment? Do you have data classifications around all of your enterprise data security, or all around your data assets? Vulnerability management, staying up to date with patching and updates is super important, managed against high, medium, low threats at the right level of service level. Third-party risk management is super important. Again, trusted third parties is one of the attack vectors and vulnerabilities we're worried about. So how do you vet third parties to make sure that they're up to snuff? How do you make sure that you have certifications, audit rights, all those kinds of things? Cloud security is super important. I said earlier that the cloud vendors are more secure than we are, and they are. But you have to build your environment in that cloud in that cloud environment. So have you done the engineering correctly to build your enclave within that cloud vendor environment? Management of non-employee access. Super important in a research enterprise like ours. I've already talked about network segmentation. It absolutely belongs in the top 10 list. Cybersecurity analytics is important, I think, even for smaller organizations, to be able to know what's going on in your environment and have enough data available in a SIM and other kinds of environments so that you can diagnose and respond to an incident is super important. For more sophisticated and larger institutions, having a data lake around tracking of data or the data that you need for cybersecurity analytics provides an ability to do some predictive kinds of things and identify vulnerabilities so that they can be addressed. And then finally, a crown jewels management program. Know what the most important things are to protect and protect them. So there's a lot of other things that you could put on a top 10 list. People might disagree with me and they might reorder them, but I think this is a reasonably appropriate CIO top 10 list. All right, so now I'm scared to death most days when I think about cyber issues, confident in our team, but staying on our toes. But part of why I'm confident is we have partners. And one of our most important partners are our government and intelligence agencies that are giving us insights and advice. So I'm really excited to turn it over to Bo Woods and to learn more about what we can do to be safer with guidance from experts like Bo.
Chris, thank you very much. That's a great introduction to myself and to CISA. Normally, if we were in normal times and in a space together, I would ask the room how many people have heard of CISA. But since I can't see your hands go up, I'm kind of going to assume that most of the people in this audience, or like most of the people that I speak to in person, to where maybe 20% know of CISA, or can say what the acronym means. I gave you a spoiler hint because it's already on the page, but it's not uncommon for people to not know who we are, and that's awesome. I love meeting new people. Also, we're the newest federal agency, so it's not surprising that most people don't know who we are. We have a pretty broad remit. So in addition to cybersecurity, CISA also looks at infrastructure security, as we call them, guns, guards, and gates, the traditional physical security that you might think of. Certainly, I know that everybody here who runs a healthcare organization has some kind of physical security. We also do emergency communication. So 911, we run a lot of the guidance and coordination for emergency communications across the country. And then we also have a National Risk Management Center. The idea with the National Risk Management Center is that we want to be able to take a holistic look across all of government and critical infrastructure, including healthcare, and to be able to properly assess risk and prioritize recommendations for private sector, for state, local, territorial, tribal, and for the federal government to be able to act, to pull the different levers of power that everybody has to ensure that the United States stays protected. Now, if I'm talking to somebody one-on-one, particularly in healthcare, after I get done with that short spiel, they ask, well, why in the heck should I have to learn another agency acronym from the federal government? You've already got too many, and I deal with HHS, 6 ways to Sunday. Well, that's a very good question. I'll use this as an opportunity to talk about some of the work that we did during the COVID pandemic, during what we called Operation Warp Speed, or it went by a couple of other names. But CISA actually formed a task force to look at COVID. We're doing it not from a public health standpoint, but how do we secure things like the vaccine supply chain? How do we protect them physically? How do we protect their physical infrastructure, their cybersecurity infrastructure? When, for instance, we were looking at standing up a bunch of federal and even state, local, territorial, tribal, or private sector run vaccination places, CISA was helping provide some of the guidance and advice on how to secure those facilities so that we could keep people safe as they were going to get their vaccinations. Also, did a lot to work with these organizations on the cybersecurity side. One of the things that we did, for instance, was we took a look at about the top 1,000 organizations in the entire supply chain, left to right, for vaccinations, and we prioritized them in a way that, to our knowledge, has never been done before, which was really kind of exciting to work on that. It allowed us to then be able to get resources to those organizations in a prioritized way so that we could ensure that they had what they needed at the time that they needed it to be able to deliver what they needed for the vaccine supply chain and chain of care delivery. And those three things that we used were, how critical are they in their role in the vaccine supply chain, first and foremost. Secondly, how many alternate suppliers, if they got taken out by ransomware, for instance, how easily would the vaccine manufacturers and others be able to stand up capabilities or buy from an alternate supplier? And then third, what's the stockpile like, or what's the useful life of whatever it is they're providing? In some cases it might be 2 weeks, in some cases it might be 2 years. But we wanted to prioritize that. And we found some really interesting things. And as you look across this supply chain, you can see it's fairly complex, even in this simplified diagram. And we started watching the organizations that we were most concerned with. We saw that quite a few got hit with adversaries. Attackers went after them for many different reasons. And in fact, by the end of the task force, we just recently spun it down and distributed those roles out to the rest of CISA and HIMSS. But by the end of the task force, we had seen every one of these types of organizations hit by and targeted by malicious actors. For some of them, it was industrial espionage. So they were trying to get a head start in their industry to start manufacturing vaccines, get them out there with higher quality, higher efficacy, higher safety protocols than what their native companies were creating. In some cases, it was for espionage. Countries wanted to know how far ahead or behind the US was, so that they could understand their national security posture and whether or not certain military or other options might be advantageous to them at that time. And then there was quite a lot of criminal activity, as I'm sure you could imagine. Not just ransomware. Ransomware has gotten a lot of headlines because it is truly insidious and it shuts down operations and could be catastrophic to your healthcare organization, to the surrounding community, and to the patients, as well as to vaccine supplies, but also criminals looking to steal information and sell it to competitors, or looking to steal information because they knew that everybody was starting to work from home, so they knew they could get in more easily and go steal patient data. And one of the things that was most interesting for us is the degree to which our cybersecurity supply chains impacted some of the supply chains in the physical world. So, Chris talked about Log4j. Log4j, which, as we found out, is in just about everything. The number of systems that Log4j vulnerability impacted were, probably dozens at each of your organizations, hundreds or thousands nationally. And so we had to have some response to that as well. Which we did while balancing a lot of our other challenges that we had and a lot of the other issues that we were working on, such as SolarWinds, which Chris also mentioned. And so this kind of gives you, everybody, a lot of people like to say, well, nobody's coming after us. There's no money in it, or nobody's coming after us. We're just a small organization, and that can be true. But at the same time, you have some adversaries, particularly the criminals. They don't care how big you are. They're going to target you or target the technologies that you're employing because they're out there because they can. Now, I also wanted to talk about some of the other work that we did during the COVID task force that, as far as we know, is the first direct link between cybersecurity incidents and patient safety issues. So we did a very in-depth set of analysis on publicly available CDC data to map out some natural experiments that happened where a hospital or hospital system in a region would be hit with ransomware, while other hospitals and hospital systems were not, and plotting the 30, 60, 90-day mortality rate to find out what the impact of ransomware is on the mortality, morbidity rates at those care facilities. And we found that there was a correlation between it. So we found that ransomware caused a statistically significant increase in 30, 60, 90-day mortality. Now, some of this was diversion of ambulances, but some of it was longer term things like if the oncology part of the hospital is down, or some of the other clinical facilities that are made possible by that hospital, if those are down, then patients can't get their therapies, they can't get diagnosed early, and so they have a higher rate of death just from the natural course of the disease, which is very, very unfortunate. And so we modeled out what some of these effects look like, not just at an individual organization level, but across an entire region. So if you look at what a conventional system looks like, you can see that everything is green. All the hospitals are able to handle all the patients that are coming into them. A lot of the hospitals, if they have a specialty case and there's time, they'll divert to another hospital. If they start to get overwhelmed, as you see in that second image there, then they can divert just fine and keep the healthcare system flowing as it should. However, what we also found is that when healthcare organizations are in a state where their beds are more full than they expect once they reach a certain threshold, and they have a loss of capacity due to ransomware, it really squeezes this patient care system. So the hospitals that were able to take on patients or safely divert them to other hospitals now no longer can. So what we saw in those cases is cascading impacts. And we saw, as we looked at it more and more, we saw that when one healthcare organization gets to around 75% occupancy rate in the emergency department, that mortality, morbidity rates start going up. And not only that, when they start going on diversion, that cascades over to other facilities, and other hospitals start hitting that magic 75% threshold of occupancy. And so you can have compound impacts, cascading impacts across an entire region, a metro region in most cases. And this is pretty significant. And estimate that because of some of the effects of high ICU bed occupancy and ransomware, that we actually saw statistically significant rise in 30, 60, 90-day mortality. Now, this graphic shows estimated number of excess deaths 2 weeks after an ICU bed occupancy hits a certain rate. And there's a longer explanation in the paper, which I'd encourage you all to go and look at. But effectively, you can look at this and say that this shows real consequences to your hospital, to your ability to provide safe and effective care to patients from things like ransomware disruptions. Now, what can you do about it? And Chris, great things to do. I'm going to start with one of the things that he also started with, which is reducing your attack surface. So your attack surface is all the systems that could potentially be hit by an adversary. And one of the things that we strongly encourage organizations to do is get your stuff off search. So there are specialized search engines that will allow adversaries to find vulnerabilities in your perimeter networks without them ever having to do any reconnaissance on you. It's done by these organizations, and these companies scan the entire internet so that they can provide heads up risk assessments to people that you may be a supplier for, or can help you provide those risk assessments and understand your supplier's risks. Adversaries can also use those types of tools. And so if you just get some of these things off your external perimeter, or get them out of some of these search engines, you can dramatically lower your threat profile. And so we have a set of guidance here. It's called Get Your Stuff Off Search. And if you just search for that term, you can find it. That's a really, really helpful tool to start eliminating classes of risk, eliminating classes of adversaries that then you just don't have to worry about them anymore coming in the way that they traditionally do. Second is a new tool and a new type of tool that we created for organizations. We call it the Bad Practices Guide. So while Chris has his top 10 list, and he had 10 great things that you can do to secure your organization, we started from the flip side. We said, everybody's got a best practices list. Sometimes those are really good. Sometimes those are, legacy practices that aren't as good anymore. But what we want to do is we want to provide some prioritization to that. We may not always know and not always agree what are the best things to do. Everybody may have a different opinion. We can all agree, or most people can agree, on what reliably fails, and we can to avoid those things. So we created a bad practices list, and there's only 3 things on it right now. Only 3. But we think that those are 3 very, very powerful things. And some of them are things that Chris mentioned. First is no unsupported systems running on your network perimeter. That is, if you have an old, Microsoft Windows Server 2003 running Exchange 2003, that's unsupported, unsupportable. You can't patch it. You can't fix it when a new vulnerability comes out for it, or when there's a new exploit or a new adversary group attacking. That dramatically increases your cost, increases your lead time to be able to fix that. So we said that is a bad practice. And some of the language that we use in this guide are things like, especially dangerous and especially egregious. So we really feel strongly about these. The second one is the use of default or easily guessable or hard-coded credentials. And some of these, it's the manufacturer has set these passwords and you can't change them. In some of them, you have the ability to change them. And particularly on the perimeter, this is one of the number 1 ways that adversaries get into organizations. When COVID had just hit March 14th, 2020, and everybody went into lockdown, a lot of IT organizations stood up remote connectivity. And what that did is exposed a lot of the bad password practices of the internal accounts to adversaries who were then able to reuse passwords that they knew already existed for those accounts somewhere else, or guess those passwords. And so we saw a dramatic rise in attacks just from poor passwords. And then the third one is single factor authentication. Single factor authentication goes hand in hand with the bad passwords or the reused passwords, because multi-factor authentication, the flip side of single factor, allows you to eliminate, I think the numbers that I've heard bounced around are over 90% of successful attacks are thwarted with factor authentication. So those are the 3 bad practices. If you don't already implement them, see if you can go check it out and take a look at those, if you can deploy those organization. In some cases, having it posted on the federal government website allows you to get permission from the organization to be able to do something about it, which hopefully it empowers you. I want to talk about Shields Up. Shields Up is a program that we launched very recently. And we launched it in order to just encourage organizations to raise their defensive posture and to equip them with some tools to do so. So one of the most powerful things that we have in Shields Up is a set of free tools and services that you can use to help improve your capabilities, your security capabilities, and your technology capabilities within your organization. Now, some of you may already know these tools. You may use them every day. For other people, they may need some brand new tools on the list. I learned about some tools from this list myself, and I do this all the time. So this could be a really good place to start. If you look around and you say, I don't even have any budget for any tools, you might find something on this list that you could take a look at and use. So I strongly encourage you to go and check it out. In fact, I think it's the main page right now is Shields Up. You can just click on that and go and check out some of those tools and resources that we offer, including some of these are free CISA resources. So things like vulnerability scanning, phishing testing, phishing simulation, web application testing. We give those to you for free, part of what your taxes go to. I talked about ransomware a lot earlier. we have a whole page called stopransomware.gov. And stopransomware.gov catalogs a lot of what's the entire federal government is doing to be able to equip you to prevent ransomware from happening. Some of that comes from the FBI, the Secret Service, from CISA, from DHS. And we want to really be able to give you the capabilities to defend against ransomware and protect against it, as well as respond and recover really quickly. One of the things we worked on is a hospital-specific one-page, it's only one page, it's like a ransomware preparedness and response guide. And it prompts you for different contact information for people that you might need to call, like your MSSP, your managed security services provider, your CEO, to start making decisions, all on a single piece of paper. And if you use that, it'll equip you to be better able to prepare and prevent ransomware, but also to respond to it if it happens. And I strongly encourage that you print that out and write in pen or sticky notes so that you can change it as it changes, but keep it somewhere that's not online. And finally, I want to talk about the excellent tabletop exercise packages that CISA has prepared that you can download for free, that if you contact us, we can have somebody who's cool in your area maybe come out and help you run them. These are incredible resources, and you can see we've got some on ransomware here. You can see that we've got some on phishing and some on a bunch of other different things. We have run some of these with healthcare in different regions. And it turns out they've worked out really, really well. And the healthcare providers and others who have worked with them have learned a lot. They've learned a lot on how to access certain resources, how to make contact with different officials that they may need to bring in to a disaster or to some type of a business interruption. And they've just been incredibly helpful. So I'd encourage you to go out and check these out, and also to reach out to us. So you can go to CISA.gov and find somebody in your region, somebody who lives in maybe in your hometown or right around the corner. You can also contact me. That's my email address right there. Just don't send me a lot of spam. And you can sign up for different mailing lists that we have. So when there's a new vulnerability announced, we can get you a lot of the information on it quicker than you might get otherwise. When we're doing something in your area, we can let you know. When we've got something else going on, or when you want to contact us, it gives you a way to get engaged and just reach out. So I thank you all very much. And at this point, I believe we will open up the floor for questions and dialogue. Okay. Chris, I don't know if you've been watching the questions as they've been rolling in. And I think you're on mute there.
Double muted. Sorry about that. It looks like we have one with an upvote. Should we go to the one from Ali Karimi to start with, Bo?
Sure. You want to take that one?
Well, I could take a first jump at it. So the question here is around AI for cyber attacks. GPT is generative pre-trained transformer, if I've got the lingo right, which I think is an open AI tool. It's a deep learning tool, and it generates human sounding text. So AI has, the question is, has AI introduced more cyber attacks, or does the process of developing and using AI provide more vectors of opportunity? I would say it's a mix of both. There's organizations like ours that are trying to develop algorithms. And so that means we've got big data repositories, and we've got research facilities, like we have something called AI Factory that someone might try to exploit as another window in. Then I think there's also the unpredictable nature of code that is generated by AI, and how does it perform? And I was talking about the risk associated with things like RPA and low code, no code. I think most of the algorithm stuff is developed at a much higher level of sophistication and so on than the RPA or low code, no code items. So, in general, I don't have any particular advice associated specifically with GPT-3. There's lots of other kinds of tools that are used for deep learning, TensorFlow, and all the rest that people are familiar with. But I think in general, we've tried to build a AI environment that's in the cloud, that's built secure by default as much as we possibly can, including entry into things like the AI factory is as highly guarded as anything else we've got. And then I think a last piece would be to use a code reviewer, a Veracode-like tool to look for vulnerabilities of your code where it may have an AI component, an algorithm embedded in that operating code. That'd be my sort of quick checklist, Bo. What did I forget, or what did I get wrong?
Yeah, well, I'll throw the aperture more than that. Artificial intelligence has I think a lot of promise in IT as well as security, as well as in health and medicine. And this is, after all, an innovation event. So I think acknowledging the promise that exists is something that that's important to do. It's been used kind of famously at DEF CON, the world's biggest hacking conference, for what was called the DARPA Cyber Grand Challenge. This is the Defense Advanced Research Projects Administration, or whatever their acronym stands for. It's part of the Department of Defense, and they give out a bunch of money to people to come up with some really cool attack tools that could find new vulnerabilities and exploit them automatically. So part of that is the finding, which is great for defenders. Part of that is the attacking, which is not so great for defenders. So there are new tools that are coming online. I don't know if the GPT-3, GPT-4 are going to be doing any of that, but there certainly are some cool AI tools for defense and offense.
Mm-hmm.
When people ask me, what I think about the use of AI in defending, I look at the statistics, and something like 60% of successful breaches, according to the Verizon data breach database, come from things that are password type attacks. So your password is password. You don't need artificial intelligence to tell you that. You've reused your password. Again, you don't need artificial intelligence to tell you that. You have a hard-coded password. Again, don't need artificial intelligence. That's 60% of it. Another 5 to 10% of it is exploitation of vulnerabilities, many of those more than 6 months old. But again, you don't need artificial intelligence to tell you these things. So what I generally recommend is to start with the things that you can use your natural intelligence for. And then once you've mitigated all of those risks, then you can start layering in artificial intelligence intelligently. I got a number of friends who do AI research and work, and a number of them, they're not mathematicians. They don't know the deep coding parts of it. They're just tinkerers and hobbyists, but they use AI and they pull in some of these libraries to start using it to do the things that they want to do. And so some of the best advice I think I've gotten on that is, don't look at how can we buy an AI tool to do a thing. Let's know how to do the thing and then bring in AI to help augment and support that. And probably with some of our own internal people who have the pain and can simply drop in some AI capabilities into what they're already doing. Now, as Chris already said, you'll want to check that if it's doing things like writing code, because as you increase AI, technology brings new accidents and adversaries. And it also brings expanded attack surface. So you have to kind of be careful on how you balance it. But I think artificial intelligence can be cool for both offense and for defense.
Makes sense. On the list I'm looking at, I've got, Bo, the next question on my list anyway is from Emily Norman. What kind of cyber defense and offense does Mayo Clinic and DHS implement today? You want to take that one?
Yeah, I'll give a start. And there's another question about what technologies do we use and why. Government uses a lot of different security technologies, a lot of different security approaches. We do a ton of different stuff. So we commonly do like penetration testing, That's one common approach. We have security design architecture reviews that we go through whenever we deploy something new. We have code audits. We have internal security processes, internal security teams. So kind of the see something, say something. If it looks like a phishing email, maybe report it to the security team. We've got a bunch of different processes. We're a very large organization. Even just DHS is several thousand people. If you look at the whole of government, it's many, many millions. And we also have a very complex organization with laws that apply, lots of contractors, lots of different hiring authorities. So we do lots of stuff. We also provide lots of things to the public for free. So I mentioned earlier some vulnerability scanning services. So these are things that you can just message CISA and we can get you signed up for vulnerability scanning. You can have it delivered to your inbox on the frequency that you want to see it. Phishing testing exercises, which are always good to help you understand how your program is doing and to ensure that your team has what they need in order to protect against phishing. We can do all kinds of different things, including tabletop exercises, which we do a lot of ourselves and are really great. We kind of run the gamut on what we do to protect ourselves. And one of the things that I'm actually really, really excited about is for state, local, territorial, tribal funded hospitals and healthcare providers. We run a program through the multi-state ISAC, which we fund, to provide protective DNS services. Now, protective DNS is a fairly simple tool that solves a lot of deep issues in security. It can help prevent against compromise. It can prevent, drive-by downloads. It can do a lot of other things. You could geek out on the technology side, but if you're interested in that at all, look into the multi-state ISAC, HIMSS ISAC, ISAC, and what they could potentially do for you. If you want to reach out to me via email, you've got my email address, so feel free.
If I could just do a brief addition, that's great material, Bo. If I could just do a brief addition about offense and defense. Offense is something that, we'll leave to the military and intelligence agencies to deal with advanced persistent threats. But we simulate some of that. We use a red team, blue team approach, where the red team looks to hack and the blue team fixes it. Ethical hacking within our environment. And we found it to be really useful. We certainly use that, including things like penetration testing, to evaluate third-party risks, to understand where we stand. On the defense side, our the philosophy I was trying to describe is, really a defense in-depth approach. Our goal in most parts is some things we want to keep completely invulnerable, but we understand there may be penetration of our virtual environment. And the goal is to slow people down until we can detect them and eject them. So, defense in depth is definitely a big part of what we're trying to do. Should we go to the next one? At least on my list, Bo, I've got Derek Kasari's question about structuring LANs. My short answer to it is, yeah, we put a lot of effort into segmenting our network, and it's really hard work. The obvious easy thing to do is to do something like segment your guest network and make sure that it's completely separate from any of your internal operating networks, so that when a guest is on site and they want to get to the internet, knock yourself out, get to the public internet. But the places we've gone next, for instance, is to segment our research activities, which is also a vector for threats coming into our environment, because it's the least productionalized part of our environment. It's places where people are hacking with code because they're researchers. So we've got a process by which we've segmented them out. And then you can think about your medical devices and IoT and other things that can be segmented. It's hard to drive segmenting all the way into the data center. It's complex and expensive, but there's clearly some low-hanging fruit, or relatively low-hanging fruit, where you can take some of the infection vectors and separate them out from the rest of the network. And again, Bo, you're the expert in this. What did I get wrong, or what would you augment?
No, I mean, that's exactly right. I back in the bad old days of cybersecurity 15 years ago or so, I worked at a hospital and we did similar things, right? Segment out that biotech network so that you have more defenses around it. The things that don't need to get out to the internet, like infusion pumps and other things, there's no reason to let them go download stuff. And then you can put strong controls in that environment, even if it's just down to the port level. But it helps you secure that. And then obviously demilitarized zones, anything that comes in from the public, like webmail. Hopefully everybody's doing webmail in the cloud now. It's way better success rates, lower attacker success and better defender success to run email through the cloud. But if you've got a website or something else like that, or some kind of a partner portal, just make sure that that's segmented out in a demilitarized zone. And then, guest wireless networks. We used to have a guest wireless that was on a cable modem. So if somebody was doing something nefarious and, those IP addresses banned for whatever reason, didn't affect the hospital. And we just called up the ISP and said, can you change our IP address? So those are a few relatively simple things, but I got to tell you, to get there, and Chris, I'm sure you went through this too, segmenting your network is not an easy step. It's an easy thing to write as a consultant. When I was a consultant, I used to write that all the time, but I think it took us about 1.5 years to do any kind of network segmentation with a fairly big team at the healthcare organization I was a part of. So, get started early, find a good way to get it funded, and go and make that a part of just what you normally do.
Yeah, it sounds like you went faster than we did. I would throw in one more segment that is sort of cheap and cheerful that I think has had an enormous effect for us, which has been to isolate our web activity. So I don't want to get into product endorsements and so on, but a tool in which essentially anybody in our environment looking at the internet is looking at a Citrix-like image of the internet that's actually presented to us by a third party. Oh, yeah. So if malware lands on a browser, guess what? It blows up somebody else's server, not mine. And I think that that's had a huge effect at getting rid of just sort of commodity grade malware that's distributed through bad websites. You can try and block those websites, but there's an awful lot of websites to whitelist and blacklist and graylist. We've just shoved them all off onto and we've made it somebody else's problem. And it's cheap and cheerful approach.
I love that.
We go to the Salil Karat question about did CISA help?
Well, so Salil asks, does CISA help organizations with active security issues? For instance, if there's an active ransomware event, would CISA help? So first of all, if you have an active ransomware, I would encourage you to put down this webcast, call up the FBI, call up your security provider, and get started on that. It's kind of like when you call your doctor and say if it's an emergency, call 911. To the question though, yes, absolutely, CISA can help. So you can call us up, you can reach out. The type of help that we can provide may be limited based on what the capabilities you are, what capabilities you already have, but we can at least help point you to some resources. Stopransomware.gov is a good one. I mentioned one of the playbooks and tools we have there. The FBI can also sometimes help. They'll come in and they will try and find the criminals who are doing it. In some cases, they can provide some technical support. CISA can do the same. And we're all on pretty much the same team. I will say that one superpower that CISA has, one advantage that we have is for certain types of information, if you disclose those to us in good faith, we're not allowed to tell other people. So we wouldn't be able to tell your regulator, for instance, which I know a lot of organizations are very concerned about. If you tell anybody in the government, it gets around. Well, that's not the case with CISA. We actually have congressional mandates. And a literal act of Congress forbids us from doing that, which is pretty strong thing to stop us from going and disclosing that. But yeah, come ask FBI, Secret Service, Pick your favorite Govy to come and help you. And again, we've got folks in region that can probably help you as well.
Definitely. So I think we probably have time for one more question. Should we take on the what kind of cloud security ISP do you use and why? I'm not sure exactly what's meant by the acronym ISP, but we certainly use a lot of Splunk in our environment, in part because it's got an open source sort of feel to it. But there's just a whole ton of tools that we use, from our managed service provider to people who help threat hunt for us, to the monitoring tools that we have embedded on endpoint devices that give us signaling about presence of malware or chaotic device activity. A whole layered set of tools. And I think the idea is to try and use tools that are defense in depth, that work together where they need to work together, that are affordable, because security costs a lot. So you want to have money for the next tool. So don't buy the gold-plated one if the silver-plated one will do. Those kinds of things. Again, Bo, if you were advising me, what did I get wrong? How would you redirect me?
Well, I mean, gosh, cloud security stuff and products. We love to advocate for any one type of tool or one company over another one. I think the answer you gave earlier about defense is a good one. And I think in general, going to the cloud gives you more tools that you can use in a lot of cases. It at least can give you fewer things to worry about when it comes to physical security. So you can focus more on the cybersecurity impact. And I do want to grab one more really quickly, which somebody asked, do you simulate attack exercises annually? So CISA simulates whole of nation attack exercises annually. And we find those to be incredibly, incredibly helpful. Not just CISA, but it's kind of a whole of government. There's 3 or 4 that happen every couple of years. Realistically, we do them annually, at least annually. And each time we run one of those exercises, it teaches us something new, some connective tissue that we're missing that we need to start building, some resources or capabilities we missed, some threat vector that just wasn't intuitive or we thought was a different level of capability and cost than we actually found out. So, tabletop exercises or live exercises, those are usually a great way to actually test your plan once you've got a plan in place, or before you have a plan in place, to show leadership that you need to develop one.
A second vote for tabletop exercise, and I think it's really cool that we linked here in the chat your resources around tabletop exercises. We use them along with other sources, but they're really great, and we learn a lot from it. The other one would be after action reports, wherever we have a suspected cybersecurity event in addition to an actual cybersecurity event. Just running down how did we do in terms of responding to a particular threat and closing the door is really helpful.
Yep.
So I think we've run just about up to the top of the hour. So I would ask, sorry, Bo, I don't mean to be taking over, but is there, I know everyone was really eager to hear from you. Is there anything that you haven't covered with us today that you want to in the last minute here?
No, and Bridget did a great job of dropping the links down in the show notes, as the kids say, and hopefully we'll be able to send those out and get them to you. But if you just go to CISA.gov and look for some of the stuff, poke around on the website, you'll hopefully find something that's helpful.
Definitely. I know you guys are really a North Star for us, and we really, really appreciate the hard work you guys do. It helps us stay safe.
Good. Thank you.
Bridget, I think it's back to you.